I'm Ethan Tashabia. You're watching RwandaTV News live from Kigali. Rwanda has ordered 1 million emergency doses of COVID-19 vaccine and hope that by February or even earlier than that, the country could have the first round of the vaccination. According to the Director General of Rwanda Biomedical Center, Dr. Sabin, orders for the vaccine doses were made from different manufacturers as the government is not only one specific vaccine, but open to receiving any that has been approved for the scientific emergency use by the World Health Organization. Dr. Sabin told the New Times that Rwanda's vaccination plan is expected to span a period of 2 years. He noted that vaccinate 60% of the total population in Rwanda, the government will need $124 million. In other stories, the government of Rwanda has started distributing relief supplies to some families in the city of Kigali, aimed at supporting vulnerable households affected by COVID-19 lockdown. So far, 69 households have received the food and other basic supplies, but authorities say there is a plan to reach out to other poor families who have been affected by the pandemic. Innocent Mugabo tells us more.
During the initial supply, some residents of Kanombe sector in Kichuchiro district were provided with rice and beans based on the number of the members of the family. A family of more than 6 people was given 14 kilograms of beans and 25 kilograms of rice. The residents expressed their gratitude for the help extended to them as life had begun to become difficult for them since they no longer work.
Previously, we had something to eat when my husband was still working, but he no longer works. But the government cares about its people. They registered me yesterday, and I didn't expect you to reach us soon. But here you are now.
I'm grateful for what the government has done, and I hope they will continue supporting us until these trying moments pass. On the other hand, some residents we found in Kimisagara sector have not yet received the relief supplies.
I have nothing to feed on since I used to get it after making laundry for people, but it is now all no more. All people are now home, so they do it for themselves. I only feed on what generous people give me.
I had just found myself a job, but it has all been interrupted. I have nothing left with me. These people are part of some of the 69,000 homesteads in Kigali city who say they have already been registered to receive relief supplies during the 14-day lockdown to contain the spread of COVID-19. The mayor of Kigali City, Prudence Rubinjisa, says that the recipients of this food are casual workers who include porters and car wash workers, among others, and that this program is to continue till the end of the lockdown. We have enough food to support all the registered families in these 14 days of lockdown. We also plan on providing milk to families with young children. We plan that as days go by, we may get other people who might have exhausted their savings. But we put up a telephone number to reach us in case anyone needs the assistance, that is to say in districts and in Kigali City. We are working with local authorities to make it possible to reach each and every one. We also request that people help out in providing information whenever their neighbors need our support. The mayor of Kigali City also says that this food support program will be done in an orderly manner with the help of youth volunteers who will distribute food door to door, observing the COVID-19 preventive measures. Innocent Mugabo, RTV News.
Thank you, Innocent, for that report. I also want to encourage you to give out to those in your neighborhood who might need some food supplies and other basic necessities. Moving on, the Ministry of Health says it has already introduced a transport system to facilitate medical staff reach their workplaces, as well as patients to get at medical facilities after public transport services and taxi motor have been halted to prevent the spread of COVID-19 pandemic. We have more. From the time the government of Rwanda reinstated COVID-19 lockdown in the city of Kigali, public transport services such as buses and coasters and taxi motors have all been suspended. Yet, many of the medical staff who are already using public transport to and from work have no other alternative to get to their respective workplaces, which they say has made their work difficult.
On the first day of lockdown, it was difficult to get to work because public transport means have been suspended. Many staff stayed at home, which paralyzed medical services.
During lockdown, it is difficult to get to work if one is residing from a distant place. But the hospital has provided transport to pick people from Nyabugogo to get to work. But getting to Nyabugogo from Shyorongi is another problem. Now we depend on people with private cars who deal in essential services to drop us to Nyabugogo. Without their help, I cannot come to work. The director of Chibagabaga Hospital, Dr. Ngundibiza Samuel, says the issue became worse in the first 2 days of the lockdown, but authorities are trying to find possible solutions. The challenge has been shortage of cars, but cars have since been increased to transport staff members to work in real time. The Minister of State in the Ministry of Health, Dr. Munga Tassis, also says the issue of transporting health practitioners has already been addressed. The Ministry of Health has been working with different authorities, including the Kigali City Authority, to find timely solution. We've hired cars to transport medical practitioners, which will solve the issue during lockdown, while those with private cars have been facilitated to move, provided they present their work badges. On the other hand, some patients also want to be facilitated to get to medical facilities. These are some of the patients who said they traveled long distances during lockdown to get to Chibagabaga Hospital.
The challenge we face in moving in the middle of the night to get to the hospital. I left home at 4 a.m. and got here at 5:30 a.m. by foot. There are no taxi motors, no cars, and dispensaries will not even give you ambulance unless you are in critical condition. You have to walk. Due to the long distance one walks, by the time a patient gets here, they're already in a critical condition. It is a big challenge. We are likely to be transferred to Sehashka. Since I don't know the place, I would have used a taxi motor to get me there. But now that public transport means are not available to work, it is going to be a challenge.
On this issue, the Minister of State in the Ministry of Health, Dr. Munga Tassis, says in collaboration with local authorities, vehicles have been set up that will help those in need to get to and from various hospitals in Kigali, while those with private vehicles are allowed to use them for emergency reasons. The issue of patients is yet a big issue that we are concerned about. Up to now, those with private cars have been cleared to move to hospitals, but the challenge remains with those without private transport means. We've been asking cars and ambulances at referral hospitals to move to dispensaries to help those without vehicles. Medical services are some of the essential services that have been given priority to continue operating during COVID-19 lockdown in Kigali. Now, nutritionists are requesting people to eat different fruits in adequate amount during this pandemic, as this may help in strengthening the person's immune system. Fruit vendors also affirm that the availability of fruits is increasing as well. Jen Motoni tells us why fruits are so important.
Food vendors in markets across Kigali say fruits of all kinds are available during this period. On one hand, some types of fruits are not always available on market due to their specific time or period of harvest, while others are currently being imported from other countries. Currently, we are wholesaling fruits at a high price, where each mango is at 300 Rwandan francs, a kilo of tamarillos at 1,000 Rwandan francs, and passion fruits at 1,200 Rwandan francs. As for bananas, they are at a high price because its harvest period is not yet due. Some local residents agree that fruits are important to one's health as they make an effort to make sure their families do eat them. Fruits help my skin to stay young and maintain a good health. When a child is fed with fruits, he or she grows up healthy, as well as his or her mind. Those that eat fruits don't fall sick easily, as their bodies are always in a good shape. A nutritionist, Fiteyesu Lair, says fruits help in strengthening one's immune system. She says each type of fruit carries its own vitamins.
Vitamine C idufasha mu gukorwa kw'insoro z'umweru.
Vitamin C helps in multiplying white blood cells in our bodies, whereas vitamins available in lemons, oranges, tree tomatoes and berries help in improving one's immune system. Vitamin A and C that is also available in mangoes, watermelons, oranges and other fruits help in increasing one's immune system as well. Fiteyesu says fruits should be consumed in adequate amount for them to be effective in the body. Like
vitamin C ntago umubiri uyibika.
Like vitamin C doesn't stay in the body for long, which means regardless of the amount one may consume, it will still be used up in a day. Usually a medium-sized lemon provides a half of vitamin C needed in the body for the day. One shouldn't necessarily take 5 lemons in a day. It's better to take, for example, 1 lemon and 1 pawpaw today, and then tomorrow take a tamarillo and a mango. As one switches up every day, it helps the body to have all nutrition it needs versus taking all fruits at a go. Taking fruits does not mean a person won't fall sick. Instead, fruits help the body to fight a disease. Nutritionists say that fruits, along with a balanced diet, drinking lots of water, and body exercises help in boosting the body's immune system. Jane Mutoni reporting for RTV.
Thank you, John, for that report. Now, in Nyabihu district, traders in Mukamira and Coral trading centers have reportedly been refusing to use electronic payment channels to pay for services. Critics say this is an open door to the spread of coronavirus as it encourages physical monetary exchanges. Umwari Jed reports.
In Nyabihu district, some shops in Mukamira and Kora shopping center have been found to use paper to cover mobile money payment codes. This discourages the buyer from using electronic payment methods. Other vendors choose to remove the number as a whole and allow exchange of money between them and the buyer. The reason for hiding the code is because people have money in their hands and we're able to exchange it there and then. It scares us to accept physical payments. However, we're able to sanitize our hands right after and the problem is solved. This issue cuts across many sectors. Through the markets and hair salons in the Mukamira and Kora trading centers, traders have neglected electronic transactions, opting for cash payments. We do not use Momo Pay, but we are able to find it on the street. It's possible to go a couple of days without finding it on the streets, but they show up eventually. Momo Pay started very early, even before COVID-19. Whoever wants to try it should try now, since it is available. Traders using electronic transactions criticize fellow traders who have refused to use online payment tools, highlighting that in addition to endangering the lives of their customers as well as themselves, the technology has several benefits, including financial security. It helps a lot to have Momo Pay because we're able to see our money on our phones. It helps that people do not know how much money you have, which also allows you to pay for services easily and also reduces your chances of theft. Nyabihu district officials admit that it has been difficult to change the mindset of people who are well informed about the prevailing global pandemic, but deliberately refuse to heed to set guidelines. As you have seen, there are individuals that choose not to use Momo Pay technology. We are continuing to encourage traders and buyers to use the service by showing them how online services are convenient and explaining the necessity of it during this time of the pandemic. Local authorities have warned residents turning their homes into bars that these are illegal practices. Officials also remind trades and buyers to adhere to COVID-19 guidelines, including keeping hygiene, social distancing, and wearing face masks properly. Umngari Jade, RTV News.
Thank you, Jed, for that report. Moving on, residents of Agatigita Swamp in Muganza sector of Nyaruguru district, which is under redevelopment, say they hope to see improvement in their produce after the swamp is completed. Gabi Muvunyi has more.
Potatoes, beans and maize are traditionally grown in the Agatigita Swamp. Work is currently underway on the 40-hectare piece of land, where partitioning and constructing of water drainage systems is taking place. The farmers are pleased with the progress, hopeful that their yield will increase in the next seasons. To harvest around 25 tons of produce. Now, that number is going to change. 7 groups of 117 farmers have petitioned the Agatigita Swamp, Once they're all organized, all these groups will merge in a cooperative in order to make the Agatigita swamp more productive. We did not choose to farm well because this swamp was unkempt, but now we are ready for a successful harvest in the next season. Out of the 90 million Rwandan francs investment, 25 million has been invested in the redeveloping of the Agatigita swamp. On a daily, a farmer working on the swamp is paid 1,500 francs. More than 270 people are employed here, testifying they're surviving on the daily wage earned from this place. People would just plant anywhere. One would plant yams there, sweet potatoes there, maize there, and there wasn't any productivity we were getting out of it. We used to work in groups of 7, but now we have come together as a cooperative so we can gain collectively. We grouped ourselves because we saw joining a cooperative will really help us. The Northern District Administration is on a beat to continue supporting these farmers. Officials had initially promised to provide them with seeds, fertilizers, and sugarcane when they recultivate the swamp. You cannot just plant and eat all the produce yourself. You should also plant and sell to the market so you can make some money. What we are asking you is, with the funds you made, plant and harvest wisely. Figures provided by the Northern District Administrative indicate that the area has swamps on a stretch of 914 hectares, of which 512 hectares has already been cleared, leaving 402 hectares still untouched. Gabi Muvunyi, RTV.
In sports, the national football team Amavubi today held their last training session at Reunification Stadium in Douala, Cameroon, ahead of the match day 2 in Group C with the African Nations Championship defending champions Morocco. The game will kick off this Friday at 6 p.m. During a press conference this afternoon, Amavubi head coach Vincent Mashami noted that the Rwandan team will go into this game with full energy, while his Moroccan counterpart is concerned about the physical presence of the Rwandan side.
So going into this game, yes, like you just mentioned, it's a do-or-die game for us because we're playing against the defending champions, Morocco. Yeah, so basically we were going to this game with full energy. Yeah, we don't have injuries in the team. I hope the boys are responding very well in training, and we are working on each and every single aspect to see that we get a positive result in tomorrow's game.